Hello, lovely people of the world. Sarah here with my sister,
Shei.
Yep, she's back as requested. And today we'll be talking more on...
Things I wish I knew about pregnancy and labor process.
As you know, my sister gave birth recently to my little niece.
Andy.
Yep, and when was that?
On May.
Months ago.
Yeah.
Oh, in case you guys are wondering about how far along I am, I'm actually 27 weeks along since yesterday. So, yay! Check how big my food baby is. Yes. Can we introduce him now? Sammy, come. This is our criminal brother. Sammy, say hi. Wait, they didn't see you. Bend over.
Come in front.
Yay.
See, they can
Yeah,
see.
like that.
It looks like me, right? Yes, we look alike. Alright, thanks, Sam. Okay, guys, he's not a criminal. It's just what we do. We bully our brother. No, he's not a criminal. He's a really, really good boy. It's just, it's girls against him. He's our little brother. That's what us older siblings do.
I know all the points we're giving you somewhat negative, but it's things I wish I knew. So,
Of course, it's gonna be negative.
it's gonna be like a little weird or whatever, but
We're not gonna complain about positive things.
so of course the positives are like you're glowing and your lips become fuller.
Oh,
this area becomes fuller. And of course, like you feel happier. You just all around feel happier because you're expecting a new life. I just wanted to put a disclaimer because it seems like it's all negative, but pregnancy is a beautiful thing, okay? So first thing about my expectation of a baby bump during pregnancy. I always thought that I would have like a nice, beautiful baby bump to show off to people like throughout pregnancy. And people would be like, oh, you're expecting, that's so cute. But actually you don't get a bump until like the last half of your pregnancy.
Kidding.
Like absolutely, like at the beginning you look awkward and you look like you have a bloat.
Like
or you ate a little
baby.
too much.
Like, you need to lose a little weight down there,
And it becomes awkward because people don't know whether you're just chubby or if you're expecting.
But define mid-pregnancy.
Like 5-6 months. 5-6 months.
I would say between 5 to 6 is when I
Yeah.
started showing.
Another point of pregnancy that's unexpected is Pantyliners are a must. I always thought like, oh, throughout pregnancy you won't have your period. Yay, like it's a good thing. But it's actually like a non-stop TMI, non-stop flow down there. It's not heavy, but it's always there. And it's enough to need a panty liner. Like, you can't just wear your bare underwear anymore. Or else, yeah, it'll just be uncomfortable. And always bring extra panty liners with you.
In case you need to change. You know why? Because sometimes the littlest things you do, like you sneeze.
Mm-hmm.
What else? You laugh. Cough.
Get scared.
Even just holding your pee. You can't actually hold it completely like you used to. In order, like right before you get to the toilet. No.
Yeah.
You are going to dribble a little bit, whether you like it or not.
You lose a bit of sphincter control.
Yes, and you're going to understand what it feels like to be old.
Another thing I never knew about pregnancy is nerve problems. What happened to me is I had carpal tunnel towards the 3rd trimester. I started having it. It's it's like pinched nerves on your hands, like from your wrist upwards, and it felt like pins and needles, and I couldn't feel anything by touch, by feel. So if at work I had to tie my mask behind my head, and I couldn't do it because I can't feel. That's the only way you can do it, by feel, right? To tie behind your head. And I had to ask someone to do it for me. I couldn't open bottles. I couldn't hold tiny objects because I couldn't feel. Like, it was just crazy. And I'm not the only one, apparently.
But was it painful, though? No.
It is, like, you know, the pins and needles, like, if you touch it, it feels, like, painful and numb at the same time.
I had that.
Yeah.
But I always thought it's because I was laying on one side and maybe my hand was under my pillow for too long.
And it's obviously there. Like, you constantly feel it. It's not something that goes away. And apparently it's normal in pregnancy, apparently, because you get pinched nerves from the extra blood flow that compresses all the other nerves, apparently. I had a coworker who had Bell's palsy in the last few months before she gave birth. Bell's palsy is when half of your nerves of your face go weak, that you can't move it. So it's like paralyzed. And yes, it's crazy because nobody ever talks about that. Nobody
So when you try to smile, it's like when you get a freeze in your dental.
Yeah.
When you smile, it's like only half your face.
Like, who would have thought pregnancy would bring out those nerve symptoms?
Yikes, that's scary. You know when you said you're having trouble tying up your mask or even opening up a bottle? I always thought that was because of some loss of coordination in a way. Because not only was I super clumsy, oh my goodness, I'm super clumsy, which is not normal.
But there's the science to that. It's because your weight is shifting, right? You're getting a baby bump, and so suddenly your body's not used to carrying an extra weight in front of you, and that puts you off balance. Yeah.
She's making me thirsty.
Another point that I experienced in my pregnancy is everything disgusting about a person is gonna happen to you during pregnancy.
And it's gonna be your new normal.
Yes. So this includes farting. You suddenly can't control it. It'll just escape you.
Honey.
Pooping. You suddenly get like urges to poop. Like I was once in a mall and I had goosebumps and I had to run to the toilet as fast as possible.
You feel like you're gonna pass out if you don't poop.
Exactly. Snoring. I actually started snoring when I was pregnant.
Me too.
Like I never snored in my entire life, and even like now postpartum I'm back to normal, but when I was pregnant I snored like an old man. And another is you'll stink. You'll have body odor. I don't know if you're experiencing it yet, but there was a time when like I would
Somebody told you? Because
No, I could tell myself.
You could smell yourself?
Yeah. Like I would notice like I would my deodorant would stop working for some reason and I would feel like I have BO.
Do you know that I don't use deodorant ever since I found out I was pregnant?
Oh, good for you.
Yeah.
I needed to.
But
that's also another point.
Lotion.
I was actually using only natural deodorant like ever since, and then when I got pregnant I had to use the medicated the secret deodorant, the clinical.
Oh.
Because it was that bad.
Can I just add one more thing? Double chin.
Double chin.
No one warned us about the double chin. I don't know if you guys could see. Oh my god, I have a double chin now.
But not just double chin, you get swelling. Towards like second to the last or the last month, that's when my swelling started getting bad. My wedding ring and my engagement ring wouldn't fit. Shoes would be so tight, and the problem with buying shoes when you're in your last trimester, it's tricky because you never know whether your foot will stay that size or not. My feet has stayed big, like it hasn't gone down.
I guess just always blowing my nose.
Yeah, you get what's the word? Nasal congestion, rhinitis, all that.
Runny nose. Even.
Runny nose, yeah. You can't take any medications during pregnancy and while you're breastfeeding. Like this is something I didn't know, that I won't be able to take medications for the next like 2 years if I plan to breastfeed still.
Oh my god.
And
no.
the only medication you can take apparently is Tylenol, and Reactin you can. Also Robitussin, they said you can take the cough suppressant,
yeah.
but you can't take any all-in-ones or anything else. So stock up on Fisherman's Friends for your sore throat.
Or Halls,
yeah, and then nasal sprays
or mist
for nasal congestion. Garlic has antibacterial properties as well. It has to be raw though, so you have to chop it up and then sprinkle it on top of your food and mix it that way.
I think I'd rather stay sick. Thank you very much.
No, actually, it really helped. It helped open up. And then ginger, stock up on ginger. However, I heard too much ginger can also cause miscarriage.
No.
Anything that's over the counter, including herbal medication. So if you think oil of oregano, if you used to take that, you cannot take that during pregnancy. Like so many things you cannot take during pregnancy.
Even Strepsils.
Yeah.
You can't just take Strepsils reciprocal.
Yeah, because it has like that lidocaine. Try not to get sick, although because you're pregnant, your immune system will be down. So stock up on like remedies such as those, and honey for cough.
Or lemon ginger tea.
Other things I wish I knew about pregnancy and labor is that landscaping down there, if you know what I mean, is not important. Once you get a big bump, like a really big bump, you can't see down there, it becomes even dangerous to try to shave or do anything down there. And honestly, none of the medical professions care. Like, I actually asked them, I said, is it protocol to like have it, shaved for labor or whatever if you're doing a natural delivery? And they said no.
They don't care, they've seen everything.
And it doesn't affect the labor process or anything. It's not like it's not even standard. It used to be standard protocol to have to shave before giving birth, and now they don't do that anymore.
Back in the days.
Yeah, back in the days.
Can you imagine though, like the nurses and the doctors gonna, wait a sec, let me go through this forest.
I can't see.
And look where the baby's head. Oh, yep, you're crowning.
And also, if you're doing cesarean, do not shave your tummy. Like, it's not up to you to shave your tummy. Leave that to the medical professions. They don't shave it. They actually use like a trimmer.
Oh.
So that way, like, because shaving is actually quite dangerous because it can cause nicks and cuts in your skin, and that can cause infection, like in the surgical side. Yeah, so they actually use like a trimmer.
When I was having those labor-like contractions, and she's like, can I do an internal exam? And I'm like, like now? Because I didn't shave. Like now? Because I usually wax. Like for my pap test, I waxed it. So
honestly, what I did is I just shave once a week. Because shaving is just, oh my god, it's so hard. Just do my best, but
get your husband to do it.
I don't like try to make it perfect or whatever. And no, I don't trust the husband because they can't feel.
You know, you can get those trimmers, man. Literally,
just like electric razors.
Yeah.
Main point, not important, so don't worry about it.
Depends on your hubby too. It's like it matters.
Another thing I wish I knew about labor is when it's time to push as hard as you can. Do not hold back. Like a lot of people have the fear that if they push too hard, poop will come out. Not true. Especially it's very, very rare. In my case, I expected that to happen because I always, you always have something in your intestine. But apparently before labor, you get lots of diarrhea, and that's because of the contractions.
Oh my god!
So it actually gets it empties your intestines, your guts completely, that you won't have anything to poop out.
But there are people who do manong. Like
yes, but you should not worry about it. Like when they say push as hard as you can, like with all your strength.
If all your dignity is out the window.
Because let me tell you, the moment you conserve even the tiniest bit of energy and you try to like hold back, that'll only make it worse, and that'll only prolong your labor. And the medical professionals will know that you're not giving it your all. It honestly feels like the biggest poop of your life. Like absolutely feels like it.
But it's not coming out the same hole, man.
No, it feels the same. Honestly, it felt exactly the same.
Is that true, Mom?
Yeah.
Like, what about pain? That's what scares me the most. The pain.
What pain are you asking? Like the tearing pain, or are you asking about the contractions?
The contractions. Like when people go like, oh my god, it's the worst possible pain. You feel like you're gonna pass out.
Pain is, I'd say, 50% physical and 50% up here. Like if you actually mentally tell yourself that it's not the most painful and you can handle it and it's not that bad, it actually turns out not that bad. In my experience, for the whole 9 months that I was pregnant, I already mentally prepared myself that, okay, labor pain is gonna be painful, but it's not gonna be the worst pain of my life. And people who have had gallbladder stones and bladder stones have told me that it's worse than
labor.
Yeah.
I've heard that.
And these are women who told me, so it's not like a man saying that. Yeah.
Kidney stones.
Yeah, those are actually worse than labor. So it's not the worst pain of your life. Give yourself a mantra. Tell yourself, okay, this is not pain, but this is rather a good thing. This is my baby trying to come out. So it's like, see it as a positive thing. It did hurt. I'm not gonna lie. It hurt. It felt like it started everywhere? Like lower abdomen, then it becomes like everywhere. Like you don't know if it's your back, you don't know if it's your side. It's like everywhere.
I kind of like it that way.
even up to your like thighs almost. Yeah. It feels like a wave. So you'll feel it coming on, getting stronger, and then reaches its peak, and then simmers.
In case you guys are wondering how come I'm able to relate, it's because I found out I have 4 fibroids along the wall of my uterus, and I think one of them was starting to degenerate, and that actually caused preterm labor-like pains. Contractions.
If it's a true labor, there's a true progression. Because like a true labor, it's weird how our body is like exact, but it is exact. Like exactly 5 minutes apart, exactly 2 to 3 minutes apart. Like there will be a pattern, and it'll keep getting shorter and shorter, like in between, and then that's when you know it's a true labor. Yeah, and if it keeps fluctuating, like 5 minutes and then 3 minutes and then 7 minutes, then it's not true labor. What did the tear feel like? It's not as bad as the contractions. So what did it feel like is, they call it the ring of fire. So ring of fire is when the head of the baby, at the center, I think, that's like the largest circumference of the baby's head, is at your hoo-ha. Once you reach that, you'll feel a burning. Like that's exactly what it sounds like. A ring. They call it the ring of fire because it's a burning sensation. And what you should do is just breathe and keep going. Like, keep going with it. Don't stop. Don't freeze up. Take nice deep breath and push as hard as you can when they tell you. And some women don't feel the ring of fire if you had like a epidural, for example.
Oh wow.
That actually set in.
Here in Calgary, they don't perform
episiotomy. Okay. Episiotomy is when they actually cut.
They make a surgical incision.
They make a surgical incision in your hoo-ha.
She calls it a
in order for the baby to come out to make more room without you tearing. However, here it's not standard protocol, so they allow you to naturally tear. Their rationale is that not everybody tears, and so if they cut you, then and you didn't tear, you didn't naturally tear, then
then that was useless.
Yeah, then they made a wound that wasn't supposed to be there.
I'm like, even if I sign a waiver, can you please?
Because I personally felt like I'd rather have a clean cut incision to heal from than a tear, It's like, when they say tear, it sounds like so bad.
And the tears are more like jagged edges.
Yeah, they're not.
Like,
another thing to keep in mind about labor and delivery, prepare yourself for 2 deliveries. This is for natural birth.
Unless you're having twins.
Yeah. For a single baby, expect 2. If you're having multiple, then expect an extra one. And that's because you're delivering the placenta after the baby.
Is it just
It's not as bad. It's not, it's way, like I'd say 10 times easier than delivering the baby, but there's still some pushing required. Like, you have to wait for them to coach you through it. Like, you can just push. Like, they'll tell you when to push and stuff, but there is a bit of effort on your part. Also, another thing to expect is in Philippines, we do not do this. We actually do fundal massage. Fundal massage is when you do this to the fundus, and that helps the clots and everything come out because it helps contract your uterus. Here, they body slam you.
They body slam your belly
to
push out
flatten you out
placenta.
And do that. So imagine you're already sore from giving birth, and then they do that to take out the clots.
Do they have to? Can't we just sign a waiver again?
It was painful. Honestly, you guys, that was painful. And you don't want to be chicken and go like, stop! Because, they're doing their job. Just a tip that I want to put out there for labor and delivery is self-control is better than taking control after you've lost it.
Trying to regain control.
Yes, trying to regain control, correct. Because you should always try to maintain your composure from the start. Yes, labor is painful, but it is always best to have self-control. This is the
helps,
reason.
You mean?
It helps with the experience too. It helps with the trauma, because the moment you just start panicking, that's actually worse, not just for you but for your baby. Your oxygenation would start to dip, and then it just makes everything worse, and then your pain actually gets worse because it's, like I said, 50% here, right?
Interesting.
So yeah, that's actually something, a tip I learned from someone. Once you lose control in that moment, it's very hard to gain it back because you're already in pain, you're suffering, you know what I mean? So once you go like, oh, I can't do this, I'm done, yeah, it's hard to, unless you have a good support person, but you are your best support person.
Yeah. Expecting to blame Justin.
I hate you. You did this to me. Another point I want to say is expect the unexpected. If you came in thinking you would have a natural birth,
or you're gonna stick to your birth plan.
Yeah.
A lot of women think
be flexible because it's very unpredictable. Giving birth is very unpredictable. You don't know how the baby will progress, how long your labor will be. My labor and delivery was very different from my mom, like from your family. Everything is very different at that moment. Yeah.
No.
So you just have to always come in with an open mind. So if you plan the natural birth and you really, really want it, like allow yourself to expect that, okay, this might end up to be a emergency CS,
or you might end up needing medication, epidural.
Just remember, at the end of the day, what's important is to have the safe delivery and a safe, healthy baby. Another thing that I wish I knew is after you give birth, you continue to have contractions.
No, don't say that.
Yes,
no.
And they're painful. They're sometimes even as painful as when you were giving birth.
No, that's
sadly.
unfair. What do you mean after, like 10 minutes?
Like,
Or
I'd say a day.
after? Ay, caramba.
The first day after I gave birth, I continued to have contractions. And that's because like your uterus is still trying to contract and still trying to come down, right? According to my mom, like different people experience it differently.
Yeah. Hell, her water broke. Mom's water broke and she still went to work. It's like, oh, well, that's normal.
You'll still experience cramps after giving birth. And so the best advice I can give on that end is to take your pain medication around the clock. Even if you don't feel pain right now, just take it. At least for like 24 hours.
What did they prescribe you?
They only gave me like over-the-counter, like Tylenol and Advil rotating. And that's it.
So you're allowed to have Advil after?
Yeah. Depending. Like if you have bleeding disorders, then Advil won't be in the mix. But yeah. Just accept it. Like if they ask you, would you like it? Just take it for 24 hours at least.
But if they ask you, would you like some morphine? Don't just take it. You have the right to say no.
Another thing is that expect to have trouble peeing and trouble pooping after.
I cannot imagine. Is it burning?
You won't only have trouble pooping and peeing because of the pain, but your body actually has a hard time doing it. Like your muscles are so weak, and sometimes even numb from if you took a epidural or anything like that. It can actually affect, and also the painkillers in general can affect your ability to poo and your ability to pee. And that's one thing that they'll watch for after you give birth, mainly the pee. The poo is like they're not too concerned because like it can take 3 days before it becomes alarming or something.
You're afraid that your bladder would be distended.
Yeah, they want to make sure that your sphincter control is there and that your bladder is emptying, because having a full bladder can actually make your uterus not contract. Like it'll stretch your uterus out and that'll cause internal bleeding. So yeah, that's why it's important to empty your bladder.
Is that why they keep you overnight sometimes?
Yeah,
after giving birth?
If you haven't peed in the neck yet, they'll keep you until you do, and you have to pee a certain amount to like 200 ml in so and so time.
How would you describe the pain?
What I did is I had a lidocaine spray that I could spray down there, and I had a squirt bottle that they provided in the hospital. So it's like a bottle that you could put warm water in, and then you squirt it down as you're peeing. So instead of your pee touching your stitch, it's watered down. I had lidocaine spray. I had to bring my own. They didn't.
So you applied like 15 minutes prior, or what do you mean?
After.
After you've already done the deed, you will spray?
In conclusion, I just want to say pregnancy is still beautiful. It's just lots of unexpected things and lots of growth from it for sure. Like your body is making a whole human being, so give yourself a break, you know, like don't sweat on the small stuff, I'd say.
Cheeky!
Can I feel?
You want to feel? Yeah.
Pause. Commercial break.
We'll be back after these messages.
She's squirming.
She could feel the squirms. For me, honestly, you guys, the best, most magical part about being pregnant is the moment you feel your baby move and kick. Oh my goodness, the movement, that was weird. It's like literally like you were riding a roller coaster. Sometimes, it depends on what movement, but when you can feel your baby squirm and
feels
swirl,
like
feels like a sudden roller coaster dip is the best feeling. And the kicks too, it's like knock knock, who's there? Yeah,
right.
and it feels so much more magical when other people could feel it too. Because at one point, early on, I was the only one who could feel it. I'm like, I felt her kick, and then Justin would put his hand, and I'll say, oh, did you feel that? And he'll go like, no. So yeah, I'm so happy that Mana was able to feel the kick. Well, I don't know if that was a kick.
And the best thing about labor is hearing everybody like give that like oh, you know, that oh, baby is here, and hearing the team
says, oh?
Yeah, like when the baby's out, they go like that's not exact words, but that's how it sounds like. It's like oh, you know, it's like wow, like it's here. And then when they put the baby on your chest, oh, best feeling ever, best feeling. And like I was in shock, unfortunately, so I didn't like cry in the moment or anything. But
She's gonna talk more on that in another video.
That's right, sorry.
What's our next video? At some point, we will be talking more on her actual labor and delivery experience. I can't wait to hear it. That'll be exciting. And on another video, we'll be talking on what to pack. What? What did you say something on?
What to pack in your hospital bag?
Yes. her advice. Okay guys, thanks so much for watching. If there's anything else you'd like to share or add on to the things you wish you knew, especially for those new moms or more experienced moms out there, please don't be shy to share your comments in the comment section below. Don't forget to subscribe, hit the red subscribe button if you haven't already done so, and thumbs up if you like this video so that we can get Manang back. Any other suggestions you might have for future videos, please do share as well. And yeah, thank you so much, Manang, for joining us.
You're welcome.
I call her Manang. Oh, you guys will understand when you
I call her Yaya.
watch our previous videos and you'll understand. So yeah, bye guys. Thanks so much for watching. We heart you. Mwah.